Hello, this is Gianluigi Pilu, and we are at the International Scientific Meeting of ISUOG in Macau, and I'm sitting with Professor John Hyett, who is the head of high-risk obstetric at the Royal Prince Charles Hospital in Sydney. And the reason that we are here is because John has just made a brilliant presentation about the experience that he had with a major challenge of contemporary obstetrics imaging, which is the presence of cysts into the posterior fossa. And I wonder whether you can elaborate a bit on that for those who are listening, John.
Good morning. It's been great to be here at the meeting. We've been looking at posterior fossa abnormalities for the last couple of years, and in particular working together with a group of radiologists in Brisbane who are very good at fetal MR and looking really at the use of 2D ultrasound for diagnosing posterior fossa abnormalities and then making comparisons to the findings from the MR. And we've seen a series of about 35 cases of posterior fossa abnormalities, and interestingly, they're all referred on the basis of those findings, and they come to us from many different low-risk screening centres. And we're finding that in about 25% of cases, we make very significant changes to the diagnosis using MR, and often those either suggest that the fetus in fact is normal, or alternatively has a more minor abnormality than that that's been suggested when they've seen someone locally.
So it would seem that in the past we were suffering from overdiagnosis of abnormalities that in reality do not exist.
I think that's actually quite likely. Over the last few years, I think we're beginning to understand more about the embryological development of the posterior fossa. We're beginning to understand more about our imaging of the posterior fossa, and that's come about not only with the use of MR but also with the use of 3D ultrasound. And also there's been significant shifts in the way that we classify abnormalities of the posterior fossa, and I think that has cleared some of the misunderstanding about the potential prognosis of some of these problems.
Well, thank you very much, John, and please watch out for John Hyett's presentation that he done at this meeting that will be on in the website in a very short time. Thank you very much, John.
Thanks.